this one too. So let's talk about the organization of the upper limb muscles. We'll review some of the terms we've learned in the past. The origin, which is the area of non-mobility. The insertion is the part of the muscle that connects to the bone that is movable. The action is what occurs when the muscle contracts, and the innervation is referring to what nerve innervates that muscle. We'll talk about the upper limb in 4 different regions. The first one is the shoulder or the pectoral girdle. Then we divide the arm into brachium, which is this region in here where the humerus is located, and the antebrachium is lower down where we have the ulna and the radius, and then the manus is where we talk about the carpals and the phalanges. So this is an organization of what we just talked about. The glenohumeral region. This is the brachium, the antebrachium, and the manus. So again, the origin is the attachment site of the tendon that does not move. The insertion is the attachment site of that muscle via a tendon that moves. We talk about the action. That is what occurs, what motion occurs when that muscle contracts. And the innervation is which nerves control that muscle movement. So when we're looking at the innervation, it's either going to be a spinal nerve, which we learned we have 30 pairs of spinal nerves, or it's going to be a cranial nerve. And the spinal nerves originate along the spinal cord, and the cranial nerves originate in the brain. We have 12 pairs of cranial nerves, and you'll identify them because they're often recorded in Roman numerals. Okay, so here we could see an example of these. So we've already discussed these muscles in the past, but in this section, we have to look at everything regarding the muscle. So let's start with the first muscle we've talked about in the past, which is called the trapezius. You can see it here in red. And it's going to originate along the occipital bone. I'll go to blue here. This is called the superior nuchal line of the occipital bone, and the spines all the way down to T12. So that's the immovable part, and it's going to insert along the clavicle anteriorly, the acromion, and the spine of the scapula. Okay, so it's connected to the clavicle and the scapula regions. So if we look at this, we know this is the movable portion. So these upper fibers is going to pull the scapula upward. That makes sense, right? So what is the action? It's going to elevate the scapula. These middle fibers, remember here's the scapula, it's going to pull it inward, and that was called adduction. So these middle fibers here are going to adduct the scapula, and these lower fibers are going to depress the scapula. So that's how you can figure out what is the action based on knowing the origin and the insertion. We could identify the trapezius muscle on the models, which you will for your practical. You can see it here. And a simple test to test the strength of the trapezius muscle is you're going to do a shoulder shrug and you're going to press down. And the innervation is via the spinal accessory cranial nerve, because you could see the Roman numeral here is number 11. So when we study cranial nerves, and if you're a little rusty on your Roman numerals, please refresh that, because we're going to get into the cranial nerves in more detail. Here is what the trapezius muscle looks like on the cadaver. Okay. Let's go to the next muscle, which is called the rhomboid major and the rhomboid minor. So first of all, the origin is going to be along the spinous processes of, let's talk about the minor first, C7 to T1, and the insertion is along the medial border of the scapula, and the rhomboid major is going to originate from T2 through T5. It's going to insert along the vertebral border. We call this either the medial border of the scapula, remember this is the scapula, or the vertebral border, where it's facing the vertebra. So this is the origin, this is the insertion. So the movement here is going to be in this manner, right? So when this muscle contracts, these fibers are going to adduct the scapula and elevate it to a minor amount. So the rhomboid major is going to elevate and adduct the scapula, also a little rotated medially. The rhomboid minor is also going to adduct the scapula and elevate, okay? And the nerve on this is called the dorsal scapular nerve. We can see it on the models here. Let's talk about the next one. It's called the levator scapula. We talked about this in the past. Its origin along the transverse processes of C1 through C4, and the insertion is going to be on this superior medial angle of the scapula. So that means upon contraction, it's going to elevate the scapula. So it's the only one that only elevates the scapula. It's going to pull it up. The nerve is the dorsal scapular nerve. You could see it here on the model. Okay. And here in purple, you could see it on the cadaver image. And the action is scapular elevation. So what have we reviewed kind of already? Trapezius, right? Action is associated with the scapula. It's going to elevate, adduct, and depress the scapula, right? The next one we talked about was the levator scapula, right here. And the only movement is scapular elevation. We talked about the rhomboid minor and major. This is going to elevate and adduct the scapula and a little bit of internal rotation. Are you seeing how we could figure it out a little bit just based on knowing origin and insertion? All right, so let's move around the front of the chest cavity. We call it the ventral pectoral girdle, right? Remember, ventral means anterior. The muscle we see here is the serratus anterior. Remember we talked about a serratus in the past? We call these muscles serratus because they look like they almost have a serrated edge, like of a knife. But in this case, this is called the serratus anterior. Remember we talked about the serratus posterior, superior, inferior, and a serratus posterior. There's a superior and an inferior, two separate muscles. We've heard about the pectoralis major and the pectoralis minor. There's a little muscle underneath the clavicle called the subclavius. So let's start with the serratus anterior. So this muscle is going to originate along the anterior ribs of rib number 1 to rib number 9. So it's going to originate here, and it's going to insert on the clavicle along that medial border of the clavicle, okay? So here is the scapula, scapula, not the clavicle, I'm saying the wrong bone. So it's going to insert along that medial border of the scapula. So when this muscle contracts, it's going to pull the scapula in a abduction, like away from the midline. So when this one contracts, it's going to cause scapular abduction, okay? So it's moving the scapula in this manner, away from the midline. And the innervation here is called the long thoracic nerve. Just to review here, it's a nice image of the serratus anterior, which causes scapular abduction. This would be the serratus posterior inferior. Remember, this is part of the erector spinae muscles. So just to review, then we have anterior, the latissimus dorsi. Okay. So a condition we have to know about associated with the serratus anterior muscle is called scapular ringing. What does that mean? You could see the image. Somebody puts their arms, flexes them up to 90 degrees, or even like does a push-up against the wall, the scapula is gonna like pop out or wing out. What's gonna cause that is a paralysis or an injury to the nerve, which is the long thoracic nerve. So the long thoracic nerve innervates the serratus anterior muscle, and if that's injured by any reason, it's going to cause this condition called scapular ringing. So generally, it's treated with corrective exercises designed to building strength in that weakened serratus anterior muscle. So let's go around the anterior portion of the chest, and on a model, you'll see the pectoralis major, or the pecs. You've heard of those, right? So the pectoralis major, there's two heads. One head originates on the clavicle, and the other head originates on the sternum and some of the costal cartilages. Costal cartilages are the parts of the ribs that connect to the sternum. And these are going to insert in that greater tubercle of the humerus. Remember that top little notch? And that intertubercular sulcus, which was that little groove in between the greater and lesser tubercle of the humerus. So when this one contracts here in the front, what is the action? It's going to assist in shoulder flexion and adduction. So the actions are adduction and flexion, and the nerves are medial and lateral pectoral nerves. You can see here the pectoralis major. You won't see the two heads, but they do exist. And on the mouse, you can see the pectoralis major. And if we pull that major up, what would be underneath it but this one, which is the pectoralis minor, which is what we're going to go over now. So underneath that major, you can see the major here. We could pull this up. Underneath it is the pectoralis minor. So this one, the origin is along rib 3, 4, and 5. And this one's going to insert along that coracoid process. Okay, so therefore, the action is associated with the scapula because it's going to pull the scapula. So what is it going to do? It's also going to abduct the scapula. You know, if it's pulling it this way, right, it's going to pull the scapula away from the midline and a little bit of rotating it downward. And the nerve is called the medial pectoral nerve. So let's move on to the next muscle. This one is called the deltoid muscle. The deltoid is kind of like a shoulder pad that sits on top of our shoulders, kind of like what football players wear, or in the 80s where everybody wore those little pads on the shoulders. The deltoid has 3 origins. We can see it nicely here. It's going to originate along the clavicle. You can see it in red. It's going to originate along the acromion in green. And in blue, it's going to originate along the spine of the scapula. And all of these 3 are going to insert that deltoid tuberosity of the humerus that I showed you when we were looking at the humerus anatomy. So if you think of the movement, it's all movements of the humerus. So these anterior fibers are going to pull the shoulder in flexion. These lateral fibers are going to pull the shoulder in abduction, and the posterior fibers are going to pull the shoulder in extension, okay? Like they're going to pull it back. The nerve to this is that axillary nerve, right? It didn't come out. It's probably underneath here somewhere. Axillary. We kind of talked about in the past how the axillary nerve actually crosses across the surgical neck of the humerus. So sometimes when we have a surgical neck fracture, it also affects that axillary nerve and therefore will affect an individual or a patient's ability to abduct the shoulder. On our model, we could see it nicely here. Okay. So if that axillary nerve is damaged, we have a compensatory muscle. So what muscle helps the deltoid, specifically in abduction? And that is the supraspinatus muscle. Okay, so the supraspinatus muscle helps in abduction. We talked about how we were learning the anatomical regions of the scapula. This region up here is called the supraspinatus fossa, and that's where the supraspinatus muscle sits. The supraspinatus is the S of the rotator cuff muscles. We'll learn that the rotator cuff muscles is the mnemonic sits. The supraspinatus originates in that supraspinatus fossa, and it's going to insert into the greater tubercle of the humerus. So when this is going to contract, it's going to pull the shoulder in abduction. So the rotator cuff muscles, they're an important muscle that groups of muscles, there's 4 muscles involved that stabilize the shoulder joint. We're going to remember these as the sits muscles. So the top one here is called the supraspinatus, which is the S. Remember the infraspinatus fossa, that's where the infraspinatus muscle is going to sit. Right below that infraspinatus, we have the teres minor muscle, okay? This is a posterior view of the scapula. And then along the anterior view of the scapula, remember the subscapular fossa is where the subscapularis muscle sits, okay? So the mnemonic for sits is supraspinatus for S, the infraspinatus for the eye, and it's the teres minor. Okay, note it's not the major, but it's the minor. And then anteriorly is the subscapularis. Okay, so let's look at these in detail. So first of all, the supraspinatus is going to originate in that supraspinatus fossa, and it's going to insert into the greater tubercle of the humerus. The action is abduction. So often will kick in if the axillary nerve is injured. It helps the deltoid in abduction. The innervation is called the suprascapular nerve. The next one, which is the eye, is the infraspinatus. And the infraspinatus originates in that infraspinatus fossa of the scapula, and it's also going to insert in that greater tubercle. The action on this is called lateral rotation of the shoulder. So what is lateral rotation? It would be like an action of scratching the back of your head in this manner, lateral rotation, okay? The innervation is also the suprascapular nerve. So on an image, the infraspinatus would be located in that infraspinatus fossa below the spine of the scapula. On the model, this is where the infraspinatus is located, right here. Okay, so this is all the infraspinatus. Remember, this is the supraspinatus, and you'll know the difference is you'll see the spine of the scapula right here. The next one, and this is all on the posterior region of the shoulder, is the teres minor. I put the major here because it's actually below the minor. The minor is going to originate along the lateral scapula, and it's also going to insert into that greater tubercle of the humerus. And this one also is going to be a lateral rotator. Okay. And the nerve on this is also the axillary nerve. Remember, the axillary nerve also innervated the deltoid. So if we look at a model here, here's our supraspinatus, the S. There's the infraspinatus, which is all of this muscle here. Okay. Right below it is the teres minor. Okay, so that's so far the S, I, T, right? Just because we're looking at it, remember the teres major is not part of the rotator cuff, but it sits right below it here. Okay, so the teres major is going to originate on that inferior scapula, and it's going to insert along the proximal humerus. And this one is going to medially rotate. So what is medial rotation? Medial rotation is like internal rotation, like scratching your back, or like buttoning your bra, okay? And the S of the rotator cuff is the subscapularis muscle, okay? Remember, we talked about this. The origin is the subscapular fossa of the scapula. This is going to insert into that lesser tubercle, and this one is also going to be a medial rotation. So what is that movement? Kind of like buttoning your bra, okay? So we could look at this on a model. This is the interior region of the scapula, the anterior portion of the scapula, and that's the subscapular fossa, and the subscapularis muscle sits in there. Sorry, my dog is up there very happily receiving dinner. You hear him? All right, so let's talk about the rotator cuff muscles. Yes, he's happy. Rotator cuff muscles. Yeah, he is cute. Here is our supraspinatus in yellow, okay? Remember the supraspinatus helps the deltoid in abduction. Below that in red is the infraspinatus, and below that is the teres minor, okay? Not the major. So as you can see, the infraspinatus and the teres minor are located on the exterior portion of the scapula or the posterior portion. Therefore, they're external rotators, scratching the back of the head. The subscapularis muscle is located on the internal portion of the scapula. So that's an internal rotator, like turning, like buttoning your bra. Remember, we just talked, another internal rotator was the teres major, okay? So somehow compartmentalizing these actions can help you in memorizing these. The last one that we're going to talk about is called the coracobrachialis. The coracobrachialis sits right in here in the anterior portion of the arm, anterior to the humerus, in anatomical position. So the origin of the coracobrachialis is the coracoid process, and this one's going to insert along the medial humerus. And because it's here, the action is going to be flexion, and it's going to pull the humerus in. So it's flexion and adduction, meaning adding the arm to the center of the body. The nerve here is musculocutaneous. So when we're memorizing the innervations, sometimes it's easiest to memorize things in compartments. And we'll learn shortly that there's 3 muscles in this antebrachium region. The coracobrachialis is one of the 3, but they're all innervated by that musculocutaneous nerve. Oh, there is one more, latissimus dorsi. Remember, we talked about that, and this is going to be on our practical coming up. So first of all, the latissimus dorsi is going to originate along the spines of T7 all the way down to L5 and then along the iliac crest. Okay, those are the origins, or the immovable portion. It's going to insert in that intertubercular sulcus. Remember that little space between the greater and lesser tuberosities? I'll have to read that in a minute. I'll read that in a minute. I didn't catch it all, but I'll definitely answer that in a minute. So it's going to insert in that sulcus of the humerus. So the movements are all associated with arm movements. So what are the movements? It's going to help in extension of the arm, correct? It's going to pull back. It's also going to adduct and medially rotate. Remember, medially rotate is like buttoning your bra. And the nerve to this latissimus dorsi is the thoracodorsal nerve. So